this is an alternative to open heart surgery. Can you explain more on that and who would be a candidate for TAVR?
So about 10, 15 years ago, TAVR, transcatheter aortic valve replacement, didn't exist. The main staple of therapy was surgery. What has evolved is a way to treat patients that are not surgical candidates and give them a different treatment option that would allow them to have the same results if they had surgery. They've performed several trials about this, and basically the outcomes have been the same in those patients, if not better, in people that wouldn't obviously be able to have a surgical aortic valve replacement. What it really focuses on is using catheters to either go and access the heart through the groin or from a alternative access and figure out basically a way to get into the aorta where the aortic valve is. And you're using this catheter to go up, as you can see there, and have a valve crimped on it, which is actually shown there right above the yellow. And then once you're in the aortic valve, you use a balloon to expand this new valve and push out that stenosed valve out of the way. And then, in a sense, you have a new valve that's right there.
So what do you do with that stenosed valve? Does it just kind of stay in there, or you take it out? How does that work?
So that valve is just being pushed to the side, and it stays in the body, and we actually use that valve to anchor the new valve within the body.
Oh, that makes sense. And just for clarification, where is everyone standing in the surgery? Because I know some of it's not robotic surgery where they're not near the patient, but is it kind of all hands on deck? How does it work? And it's actually the surgeon who's putting the catheter in?
So it's a team approach before and during the case. You have a surgeon that's in the room, and you also have an interventionalist that's in the room. Your patient is going to be in the center of the room. They usually stand to the right side of the patient. I'm usually on the left, and we're taking images with either fluoroscopy, which is giving us x-rays so we can know where we are during the procedure, or with an echocardiogram, which we talked about earlier. Sometimes we need to see exactly where we are and use a different modality to figure out how the procedure is going.